For 1.3 million Americans, rheumatoid arthritis is a painful fact of life. It most often strikes women between the ages of 20 and 50, often with crippling results. Over the last decade, a range of biologic treatments have given patients relief. For 35 years, just walking was a struggle for Barbara D'Amico.
Sometimes I didn't even sleep, I was so painful.
Barbara has rheumatoid arthritis.
Rheumatoid arthritis is a process where the immune system, for unclear reasons, goes awry.
It starts with swelling of the joint lining, and as it progresses, that lining thickens. Inflamed cells release enzymes that can destroy bone and cartilage.
They didn't have medicines when I was young like they do now.
Years ago, doctors had a small arsenal of over-the-counter pain relievers or drugs like prednisone. Later, drugs called disease-modifying anti-rheumatic drugs, or DMARDs, provided greater relief.
Most commonly used is methotrexate.
Then came a big breakthrough, a class of drugs called TNF inhibitors. They block a specific protein that aggravates RA.
In general, we've seen a change in treatment strategies in the last decade to a more aggressive use of existing medications, combinations of therapies.
TNF inhibitors block specific hormones that aggravate RA and are sometimes given with other drugs like methotrexate to stop further joint damage.
My senior year in college, I was a cheerleader, and the homecoming game, I woke up that morning and I had a really sore, painful wrist.
RA so damaged Frances Johnson's hands, she needed joint replacement surgery. 7 years ago, her doctor prescribed a TNF inhibitor. And it struck the right note.
I'm very thankful that I haven't had any serious pain very much at all since taking that.
Some TNF inhibitors can be self-administered.
The needle's in.
Okay.
Here it comes.
Okay.
Others must be given in a clinical setting.
I only wish they'd had this drug when I was like 20, and then I probably wouldn't be in this condition today.
Another class of biologic drugs target the inflammatory substances produced by the body.
It is a protein. It's designed to specifically inhibit one of the signals that's used to communicate within the immune system.
It's almost made my hands really normal. You know, now I can make a fist.
But all biologic agents increase the risk of infection, both minor and serious. For this reason, some people try dietary changes as well. Dr. Harris McElwain says certain foods reduce inflammation.
Pineapple, dark grapes, dark cherries, blueberries, broccoli.
While others trigger it.
Like the sulfites or tomato sauce or wheat.
But diet alone can't do the trick.
Controlling your body weight, very importantly adding the exercises to strengthen the joints and make them more flexible, and then finding the proper medications.
Physical activity can be a challenge for people in pain, but therapists find those who take the plunge feel a huge difference.
People with rheumatoid arthritis have less joint swelling, actual measurable joint swelling, if they participate in aerobic exercise, walking or water or bicycling.
Whether it's work or play or sickness, attitude's all. And no matter what it is, you just keep on plugging along.
The next big thing in the research pipeline is an oral medication called Mastanib. It stops abnormal immune responses that cause bone and cartilage damage. Results of the first human trials in France show side effects such as swelling and rash subside after a few weeks, which means it has potential as a long-term therapy.